Today we are going to be talking about the infraspinatus. The infraspinatus is one of 4 rotator cuff muscles in the shoulder. The origin of the infraspinatus is the infraspinous fossa of the scapula, and the insertion is the greater tubercle of the humerus. The action of this muscle is the same as teres minor, which is adduction, lateral rotation, and stabilization of the glenohumeral joint. The infraspinatus is part of the abduction force couple for the shoulder. The deltoid and the supraspinatus start this movement, while the subscapularis, infraspinatus, and teres minor compress and depress the humeral head. The nerve is the suprascapular nerve C4, 5, and 6. From a clinical aspect, a patient might present with weakness or pain with lateral rotation of the humerus. They may complain of functional problems like not being able to brush their hair or shampoo their hair in the shower. Another functional limitation you may see is the patient having trouble drinking or eating.
To manual muscle test this muscle, the clinician must first ask the patient to lay prone. This is the best position for testing the infraspinatus. The clinician will then ask if the patient can get through the range of motion in lateral rotation, thus giving the clinician an understanding of what the muscle strength is. If the patient can get through the full range of motion with gravity, the patient will be at least a 3 out of 5 muscle strength. The arm should rest on the table at a 90-degree angle. The clinician's hand should be placed under the arm near the elbow and the other hand stabilizing the humerus. By doing this, the clinician prevents adduction or abduction, getting only lateral rotation from the infraspinatus. The clinician will then apply a force in the direction of medial rotation. You can do this in other positions as well if prone is not acceptable to your patient. The test can be done in supine with elbows at the side at 90 degrees. The clinician will stabilize the humerus and again push in the direction of medial rotation. If the patient were confined to a wheelchair, don't worry, you can still manual muscle test the infraspinatus. In this instance, the armrest will have to be taken off so that the patient can move their arm into lateral rotation. The clinician will stabilize the humerus and apply a force in the direction of medial rotation.